Getting vaccines to everyone, regardless of their circumstances, is something Governor Jared Polis has been passionate about. He even created the Colorado Vaccine Equity Task Force to make sure that everyone has equal access to the shots. But we know that health equity is not as simple as creating a task force. It's a complex issue that so many people are working to address right now. So joining us now is Dr. Jaya Kumar, the Chief Medical Officer from Swedish Medical Center. Thanks so much for taking time to talk with us about this important issue. To tell us to start, how does socioeconomic status play into a person's overall health?
Thank you, Mackenzie. Glad to be here. Mackenzie, you may know that only 20% of our health is dependent on clinical care, the care that we received in doctor's offices or hospitals. 80% of our care is driven by our health behaviors, our socioeconomic status, as well as our neighborhoods. So it's very important to address these behaviors and these circumstances which lead us to choose certain decisions over the others. The conditions in which we're born, live, learn, play, work, worship, and age are the cause social determinants of health, and they have a profound impact on our health. They influence the opportunities available to us to practice healthy behaviors, and hence certain racial and ethnic groups or certain socioeconomically disadvantaged groups may be at a higher risk for illnesses, including COVID-19.
Yeah, tell us a little bit about that. I know COVID-19 brought a lot of this to light for a lot of people. How do those factors adversely affect just certain population groups?
COVID-19 illness has intensified the social determinants of health issue in our society, in our community. You know, Hispanic Americans, African Americans, and Indian Americans are at a significantly higher risk of acquiring the COVID-19 illness as well as dying from it. And you mentioned vaccine inequities that we saw during the pandemic as well. And that goes a long way to say that if we do not narrow these disparities in these groups, we will never be able to achieve health equity.
Absolutely. And tell us, too, I know you're passionate about this. Why is health equity something the community and healthcare providers need to address or be paying attention to?
In a developed country like us, we've seen a decrease or decline in disease illnesses among all subgroups of population except for these groups. And that's where the importance of health equity comes from. Why are certain groups at a disadvantage than the other groups? It's the collaboration between the community and the healthcare providers that'll go a long way to narrow these disparities to benefit them from practicing healthy behaviors and achieving the health that's available to other subgroups of the population.
Absolutely. And I know a lot of people watching this might be wondering, how can they help? What can we all do to promote health equity?
I think raising awareness is one thing, but as well as championing these groups that are targeting health equity is important. Volunteering for community, volunteering for these health equity groups that will go a long way for us to bridge that gap.
Absolutely. And tell us, too, what Health One and you guys are doing to promote health equity.
Sure. Health One is championing mental illness and mental well-being in the population. As you know, we're the largest provider for behavioral health in all subgroups of the population. We partner up with local community partners like Mental Health Center of Colorado and NAMI to promote mental illness. Other things that we support is supporting careers in healthcare. We are a healthcare company, so that's what we do. We support healthcare careers through our partnership with Regis University and Emily Griffith Foundation. Also, we support early childhood developmental programs through United Way. It's just one of the few things that our community and healthcare providers partner up in doing is our colleagues giving back to the community through volunteering or through participation in civic groups. There are a lot of things we do, but there is a lot of room to do more. So we look forward to partnering up with our communities to do more.
Absolutely. Well, thank you so much, Dr. Kumar, for all your information on this. It's so important. We really appreciate it.
Thank you. Thank you for letting me be here.
Of course, and we'll be right back.